Download your favourite apps with Huawei Petal Search. Download now.
Good afternoon, everybody. Today I'll start with an update on testing numbers and the uptake of the COVID Tracer app, and I've got a few messages from the police. And then I'll hand you over to the Director General to provide today's case details. Then, of course, we'll get into questions. But before I start, I do want to make a plea to all New Zealanders. Please be cautious about the information that you are getting on COVID-19 cases. My plea comes in two parts. First, please treat the information that you are receiving on social media as a rumour. That is, unverified and therefore something that cannot be relied upon to be true or accurate. It is entirely normal to be inquisitive, to ask questions, and to want to know what's going on. But what we've seen over the last 24 hours has taken things to a new and concerning level. It's troubling. One piece of information in particular has spread like wildfire, and it's created extreme distress for the family that is at the centre of it. The claim was that a woman in the present COVID cluster contracted the virus by sneaking into a managed isolation facility, and it included a number of vile slurs. Not only was it harmful and dangerous, it was totally and utterly wrong. I want to say this again. It did not happen. It was fully investigated, and that investigation concluded that it was completely false. There have always and always be rumours, but this one smacked of orchestration, of being a deliberate act of misinformation spreading. Countless journalists have told us they were sent the email many times over. At a time when we are fighting a pandemic and we need all hands on deck to beat it down, this sort of behaviour is deliberately designed to create panic, fear and confusion, and it is completely unacceptable. So please, New Zealanders, think twice before sharing unverified information. I'd like to once again thank the media for the responsible way they've reacted to this latest turn of events. They have tested these claims very hard, as they always do, but they have sought official word on truthfulness before reporting, and I want to again thank them for that. The second part of my plea is this. Please take your information from official sources, such as this 1 p.m. briefing. Behind the scenes, from early on every morning, there are dozens of dedicated people tracking down, cross-referencing and checking every bit of information in preparation for these media conferences. That means that the information here is verified. The information that we share during these press conferences on the Covid-19 and Ministry of Health websites and the Covid-19 and Ministry of Health social media pages is information that you can trust. If a mistake is made, it is quickly corrected. From time to time, that will happen. So, on to the testing numbers. We continue to see both unprecedented testing and unprecedented levels of processing being done by our labs across the country. Yesterday, they processed 23,682 tests. In the past 3 days, our labs have processed 63,231 tests, bringing our total overall number of tests to 571,942. This is an exceptional effort, and I'm really impressed with the speed and efficiency with which the labs have been able to work. It is a huge effort of the primary care workers undertaking the swabs, and I want to thank them as well. The system is working at top speed, and that should give us all confidence. So a huge thank you to all those involved who are doing a phenomenal job. A few words of caution though, the high volumes of testing we are seeing is slowing down the processing, and that means that the usual 24-hour time frame for turnaround in some cases is extended to 48 hours. As noted yesterday, there are other elements of the process, including reporting those results back to primary care and reporting back to the patient. But the important thing to note, though, is that positive results are reported first and promptly. So patients who get a positive result will hear back quickly. High-risk swabs are also being processed as a matter of priority to ensure that they are at the front of the queue. So again, we want to thank everybody for their patience. If there has been any delay in them getting a test result, please know that there are a lot of people working very, very hard to get the test results out as quickly as possible. Also a reminder that those who are at risk or who have symptoms or who are asked through the contact tracing process to get a test are the ones who should be getting a test. If you are well, please don't get a test because you will potentially be slowing things down for everybody else. We're asking employers and churches to make sure they keep clear information on all of their staffing and those who are attending their congregations so that they can be contacted quickly if necessary. We are load balancing the processing of tests across the country. For example, in Christchurch today, about 4,000 tests from Auckland yesterday will be processed to ensure that we can speed that process up. So on to the contact tracing. The New Zealand COVID Tracer app has now recorded 1,374,200 registered users, and those numbers continue to climb rapidly. There are now 193,505 QR code posters up and down the country, and I do want to thank again businesses for the way that they have taken those up and are now displaying them promptly. A few quick reminders there. Please make sure the QR code posters are displayed in a prominent place. If you're having high volumes of people, display a number of posters so that people don't have to queue up in order to scan. And please make sure that the QR code posters on display are the official QR code posters and not one of the QR codes that can be generated through other sources. And a reminder to all New Zealanders, please keep track of your movements, keep track of the people that you're coming into contact with, so that if you are needed as part of the contact tracing process, you can participate quickly in that. Finally, a word on travel. Police are reminding the public that travel into and out of Auckland remains very restricted, and that generally people cannot travel across the boundary for work unless they have an exemption. They've seen an increase in stops and people being turned back, and of course they're seeing an increase in the number of people who are unhappy that they cannot cross. So, travel into and out of Auckland remains heavily restricted to stop the possible spread of COVID-19. Please check the covid19.govt.nz website before travelling to check if you are able to cross that boundary and whether or not you need to apply for an exemption. You cannot travel across the boundary to go to work unless your workplace has an exemption. So again, please check the COVID-19 website. And if you are not eligible to cross the boundary, you will be turned around by the police. So now for today's case update. Dr. Bloomfield.
Thank you, Minister. Kia ora koutou katoa. So today there are 13 new confirmed cases of COVID-19 to report. 12 of these are in the community and 1 is in managed isolation. I'll start with the latter. This case is a child who arrived in New Zealand on the 3rd of August from Afghanistan via Dubai. The person has been in managed isolation at the Pullman Hotel in Auckland and tested negative around day 3 of the isolation period and subsequently positive at around day 12. They've been transferred to the Auckland quarantine facility now. Turning to the 12 cases in the community, all are Auckland-based, and based on our current information, none has travelled outside the Auckland region recently. From early investigations, all have a connection to the existing outbreak as close contacts of cases already reported. So saying, 2 of the new cases are household contacts of the case we've previously reported that is still under investigation. This is the GP from Mount Wellington, and all others are epidemiologically linked to the cluster. There are currently 3 people receiving hospital level care. 2 are in Auckland City Hospital on a ward, and 1 is in Middlemore Hospital on a ward as well. 1 is the person we've previously reported as being in hospital. 1 has been admitted overnight from the Auckland quarantine facility, and 1 person connected to the community outbreak who was in the community has also been admitted to hospital. To date, 66 people linked to the cluster have been moved into the Auckland quarantine facility, including 29 people who have tested positive. So the 13 new confirmed cases to report today bring our total number of confirmed cases to 1,271. The total number of active cases is 69, of which 49 are from the community outbreak and a further 20 are imported cases that are in the quarantine facility. As I've said, of the 49 cases in the community outbreak, all but 3 have been already linked to the cluster. The other 3 are household, and they relate to that one case previously reported, which is still under investigation. However, all the evidence suggests that this case will be able to be linked to the same cluster. Our National Contact Tracing Service has 1,536 close contacts identified, and as of 10 a.m. this morning, 1,322 of those people had been spoken with and are all self-isolating. I want to thank all those people for their tremendous response and also for remaining in self-isolation in the meantime and being tested if instructed. If you are called by our contact tracers, please take or return the call. And as I say, and if you look at those numbers, it's well in excess of 80% already who have been successfully contacted. So thank you to everybody who is doing so, that is answering the call or calling back. In addition to the Miracold and Finance Now workplaces and a number of educational organisations we have also had contact with, we're also working closely with 2 additional religious organisations in relation to contact tracing and testing. And once we have confirmed this with them that they are comfortable with us releasing the information and ready, then we will do that, and that will likely be later today. I do want to thank also many people who are going and getting tested. I know there are still some waits at CBACs. There is a long list of testing places available on the Auckland Regional Public Health Service website. For those who are waiting patiently, thank you very much. And Auckland Transport is going to help with traffic flows at some of those CBACs where they have queues. Moving to Tokoroa, it has been confirmed that one of the positive cases from Tokoroa visited Toi Ohomai Institute of Technology's Tokoroa campus while they were feeling well and before they were aware of any potential exposure to COVID-19. There have not been any further positive cases confirmed in Tokoroa, and public health staff are directly contacting anyone who may have been in contact with the person who visited the Polytech campus during the period that we're interested in. If you are not contacted by public health at this point, no further action is needed. However, of course, if you develop any COVID-like symptoms and have attended Toi Ohomai Institute of Technology in Tokoroa on the 10th or 11th of August, please seek testing and self-isolate until you receive your result. The DHB, that's Waikato DHB, has provided a mobile community-based testing centre in Tokoroa for anyone seeking a COVID-19 test, and this will remain there for the time being. We ask all workplaces, churches and other institutions, as the Minister said, to please keep up-to-date records. Now is the time to update your records of your staff and of any workforce members or volunteers or congregational members. And so we can quickly contact people from any particular site that may be of interest. And finally, just the reporting of this latest outbreak. I had asked my team, and I've talked with Dr. Colin Tukuitonga this morning about us reporting this outbreak separately from our earlier cases. So from today we will be describing the ethnic and age breakdown and the characteristics of this outbreak as a distinct community outbreak, and we will update that information once a day as well based on the new cases that are reported at the 1 o'clock stand-up. Thanks, Minister.
Thank you. Happy to open up for questions.
Minister, you said that the social media rumour smacked of orchestration. Do you have any insight or theories into who might have orchestrated it?
No, I don't, but it's clear that there are people out there pushing this hard, and my message to them is stop doing that.
And are you looking at taking any action against Facebook or any individuals in particular in relation to it?
No, my plea to New Zealanders is please be responsible and sensible about what you choose to share on Facebook. If it's not verified, please don't share it. Ultimately, we want everybody to accept some personal responsibility for the information that they're out there sharing.
Are you exploring any avenues, though, for sort of any action against any of the social media companies?
Not at this point.
Have you asked your Cabinet colleagues to adhere to that advice as well, and one in particular who did share unverified information last week?
Of course, I think all ministers, all MPs, all leaders in the community should again lead by example and be careful about the information that they choose to share.
Also been upset in communities about, racist comments that have been sparked by ethnicity. What is your message to New Zealanders when, and especially if ethnic data and that sort of thing is going to be released, about tying anything like that to COVID cases?
Look, I think we've said this time and time again here. People are not the problem here. The virus is the problem. People are the solution. There should be no shame and no blame in contracting COVID-19. It is a virus, and it is a particularly easy one to catch if you have been exposed to it.
That online, do they discourage potentially communities from coming forward if that's going to be the reaction from
My
some
plea to all
sections?
New Zealanders is be supportive of the people who are coming forward to be tested, be supportive of the people who have been tested and received a positive outcome from that. There's no shame in it, but by seeing the type of behaviour towards victims of COVID-19, if you like, then actually we're sending the very wrong signal. And actually we should be sending a signal of saying, do the right thing, come forward, be tested, isolate, and make sure that you're helping to fight the virus.
Dr. Bloomfield, yesterday we were, you mentioned that we were getting results back from the Americold testing of the surfaces there, and have you got any update to make about that?
That swabbing has been processed right at the moment, and we're hoping to have those results later today. And I just want to follow on from the comments the Minister just made. Our outbreak earlier in the year was a very different type of outbreak. The cause of that was from people returning from overseas, and so the ethnic and age characteristics of ethnicity and age characteristics of that outbreak were quite different from this one. It was largely people of New Zealand European ethnicity, and generally a younger group between sort of 30 and 50, being mostly the people coming back from overseas. We had much lower rates of infection amongst Pacific and Maori in that outbreak, but the highest rates of testing in those groups. So those were the groups who were actually coming forward, as they are this time, to be tested. And again, there should be nothing in the description of this outbreak that suggests that there's anything about this community that is a problem, and in fact they have been incredibly cooperative and incredibly supportive, and we should all be thanking and supporting them.
So are you still concerned about this outbreak?
So, but let's go over here and we'll...
Are we still investigating Americold? Just give us the update on working theories. Is that the best lead at the moment, where it's coming from?
Well, it seems to be as a workplace, because the case that has the earliest onset date of symptoms is an Americold worker. So we're doing the environmental testing. We're also, it may be a long shot, but we're working with our Victorian counterparts to look at the genome sequencing of the cases that they have had that worked in an Americold facility there. There may well be no link, but it's one to exclude. But it may well be we still don't find the exact route of transmission for that first case, but we're not leaving anything to chance.
Minister, there's no testing station at the port of Tauranga. How are you expecting those 6,000 workers to be tested without extra resources there?
My understanding is that there is testing available. There's a mobile testing site there.
That's going in tomorrow.
It's going in tomorrow, so there'll be a mobile testing site going in there tomorrow. We do acknowledge that will take a little bit longer to get through than the testing at the other ports and border entry points, and so we will certainly exercise a good degree of flexibility there to recognise that that's going to take a bit longer.
Dr. Bloomfield, can you talk a little bit more about that testing mobile station going in tomorrow?
Yes, actually, I just had a text from the Chief Executive of the DHB there, so they've been working very closely with the port. It's made a building available. There are 8 nurses going in tomorrow and admin and IT support, so they will be testing now through the week for as long as they need to. And likewise, putting a priority in terms of our testing at both ports of Auckland and Tauranga Port, a priority on port workers who may have had or been more likely to have contact with crew from ships in particular, so that would be the pilots, stevedores and others.
Do you have an update on the legality of masks and the ability to enforce it under level 3?
Yeah, I've answered questions on this morning as well. The issue that we've got here is a supply challenge, so we want to make sure that people can access a mask. As we've already said, we've already released 5 million masks from our national stock, and 3 million of those are being distributed through community organisations for those who can't afford to pay for them, and the supermarkets are working to ensure that they've got good stocks and that they're available. And of course, people can make their own masks. But look, here's the reality: people can. We could make it compulsory and spend a lot of time on enforcement. What we need here is a cultural acceptance amongst all New Zealanders that if we're encouraging you to wear a mask, we're doing that for a reason. New Zealanders have shown through our level 4 lockdown, our level 3 lockdown, and now that they accept that there is a need for restrictions.
Or is it supply or legality, and does the Public Health Response Act cover the enforcement of masks, for example, if you decided that it should be mandatory?
Look, we could make it mandatory, but the issue here is one of supply and also one of acceptance. Ultimately, if you make something mandatory, you're talking about a lot of people, and are we going to put a lot of resource into enforcing that? Actually, my message to New Zealanders is, if we're asking you to do it, we're asking you to do it for a reason.
But you have the legal authority to do it.
We can do if we need to.
You mentioned the restrictions on movement in our Auckland. Are you confident there's due diligence taking place at the airports? The roadblocks are obviously there and you've got the military manning those, but there have been some sort of anecdotal concerns expressed about flights going out of Auckland.
Air New Zealand have been incredibly cooperative in making sure that people aren't getting tickets if they don't meet the criteria.
Minister, some people in managed isolation facilities in Auckland are struggling once they get out of managed isolation to get out of the city because of restrictions and flights being cancelled. What plans are in place for those people? Do they get to stay at the facility for a couple of nights or...?
Look, that is one to direct to Dr Woods. I know that they've been working very carefully around the logistics of people being released from managed isolation who may then need to transfer to other parts of the country. So I'm sure that either her or Air Commodore Webb would be able to give you the detail about how they're doing that and how they're doing that safely. I know that there's been quite a bit of focus on that, though.
You know what the process is when someone does leave, as getting ready to go out into Auckland in level 3 after they've been in managed isolation? Do you know what?
Yes, like I said, that is something that I know that they've focused quite a lot of attention on over the last 3 days. So I'd encourage you to address that question to them.
Minister,
we'll come over here. Yeah.
Minister, there are reports of some people leaving Auckland to go to Waiheke, and understandably the locals there, where there is not a case, are pretty upset. What are your thoughts on people doing that?
Look, at level 3, people should be minimising their movement. That's clear. I think everybody understands that. You stay home unless you've got a very good reason to leave. So if you're an essential, if you're going to work and you're allowed to go to work under level 3, then, by all means you should do that, but go to work and then go home. If you're going to the supermarket or you're going to seek medical attention. But people shouldn't just be out and about taking a day trip to Waiheke.
We've had a couple of people come to us to say that urgent clinics have charged them, in some cases, hundreds of dollars for a visit to have a COVID test, even when they were symptomatic. Do you know, should this be happening? How is it happening? And what's your message to clinics that are charging people?
It should not be happening. COVID-19 tests are free. The government is subsidising those and paying for those to make sure that they are free. I'll invite the Director General to comment on that if he wishes, but we have been very, very clear. In fact, we've gone so far as to get posters printed up that will be put in all GP practices up and down the country to make it clear that you should not be charged for a COVID-19 test.
Nothing to add, Minister, but if there are specific examples and they're brought to our attention, we will always follow them up.
Is it realistic to be looking to go ahead with an election, given that basically if Parliament doesn't dissolve on Monday, September 19th becomes difficult? And Dr Bloomfield, will you be contributing in terms of the safety elements or the expectations that you would have before an election could go ahead?
Look, that's ultimately a matter that the Prime Minister will make comments on tomorrow morning, and I don't think you'll get either of us making any other comments on that in advance of that.
A question from Australia on the vaccine, and the Health Minister there has announced they're close to signing off permits to produce a vaccine in Australia. Will New Zealand piggyback off that? Will you go it alone? What are your thoughts on the development of the vaccine?
Look, New Zealand is actively exploring all of the options around vaccine. We are buying into the different vaccine development, consortia, if you like, to make sure that we are in there and that we're actively engaged in that. We're also working on making sure that we are ready to go when a vaccine is available, in terms of being able to distribute it and in terms of being able to administer it. So there's a whole lot of work happening in that regard. So at the health end, we're focused on being ready for a vaccine when it's available. Dr. Woods, in her capacity as Minister for Research, Science and Innovation, is leading the work in terms of making sure that New Zealand is right up front in terms of the development of a vaccine and being involved in that part of the process.
Your latest update in terms of timeline when that might be available? Minister Hunt, your counterpart in Australia, says most likely next year. Is that your advice?
Look, how long is a piece of string? At this point, it's too soon to put a particular timetable on it. Yes.
Bloomfield, just circling back, on a health perspective, how comfortable are you with an election going ahead if it means going ahead in a level above level 2?
So we've already given our advice, and that was our advice was to the Electoral Commission about the public health sort of aspects of conducting an election under alert level 2, and the Prime Minister's already talked about the planning the Electoral Commission has done to do that, but we don't play any other role in advising the government on the dates of an election.
So it's your view that an election shouldn't go ahead, which would be consistent with the Electoral Commission, level 3 or above. It would have to be at level 2 or below.
I don't have anything to add to the comment I've already made.
To the Electoral Commission, because that's the position they've taken in terms of the ability to safely hold one at level 2.
We haven't provided any further advice. That advice was provided a long way back, in fact, when we were in the earlier stage of the pandemic, about the physical distancing and other arrangements that would need to be in place, and that's the planning the Electoral Commission has been doing based on, in part, our advice from earlier in the year.
I'm just going to share things around a little bit. We've got a question over here.
A high number of Māori in Pacifica. Are you working with Māori health providers to reach into those communities, and if so, how?
Yes, and I'll get Dr. Bloomfield to comment on that as well.
Yes, very much so, and right from the start here, in a range of ways. In fact, this morning I was just on joined the Zoom meeting of the Pacific team that's both Wellington and Auckland based. Our Māori health team have been in every day, and they're working very closely with Māori organisations across Tamaki Makaurau, as well as in the Waikato for the family in Tokoroa. So, I mean, as we found in the earlier outbreak, iwi organisations have lent in incredibly quickly to support us, and the Māori health organisations and Pacific health organisations have got excellent sort of channels into those communities, so they're an invaluable part of the response.
Yeah,
follow-up to that.
Come here. No, you go.
It's just a follow-up to that. Are you more concerned about this outbreak because it is affecting the Māori and Pacifica communities as opposed to the younger Europeans from last time?
Well, what I can say is that one of the big drivers of our rapid response last time is we were worried about more vulnerable communities, including Māori and Pacific, and as well as disabled people and older people. And so, yes, it is a concern here that this outbreak is in our Māori and Pacifica communities, and hence why we are working with every organisation to really get into that community. And just to reiterate the point I made earlier on, these communities have been fantastic in their response, and I do want to thank them for that.
Okay.
Two questions on the COVID Tracer app. Firstly, would you prefer that businesses and workplaces take down any other QR codes posted from other suppliers? Because obviously there's been a proliferation of different solutions and it might confuse people.
Yes, the answer to that question is yes. The team who have developed the COVID Tracer app have worked with some of those other app developers to ensure that other apps can use the QR codes. Obviously, it's in no one's best interest to have a proliferation of different QR codes for different apps. So we've developed our QR code now so that it can be used as a universal location indicator. So even if people are using a different app, although I'd encourage them to use the COVID Tracer app because that is what allows us to push notifications out to them, but if they are using a different app, they should be able to use the standard government QR code.
Slightly technical one, sorry. There's an exposure notification API that was developed by Apple and Google to help with notifying people who have been in contact on, who have Androids or iPhones. Is that going to be integrated into the COVID Tracer app at any stage?
I'm happy to come back to you on that one.
Just following up on that, for clarity, do businesses need QR codes and a manual register, for example, for those that don't have phones? Or
So what we encourage businesses to do, so it's encourage at level 2 and it's require at level 3, to ensure that people are either scanning the QR code or keeping a record of the fact that they have been there. So not everybody will carry a phone with them. Not everybody, particularly some of our elderly, don't want to use that COVID Tracer app. So therefore they should have some other form of recording people who are coming and going. Now at level 3, obviously there's many fewer places that people could come and go from, but we do require them to do that at level 3. At level 2, it's an encourage. So we'd encourage people to make sure that they're using the QR code, that they're supplying a way of people recording the fact that they have been there if they're not using the Tracer app.
So if the business has a QR code, they also need a manual register, or they don't?
Well, they need something for people who aren't using the QR code to be able to register the fact that they have been there.
And just a quick question as Education Minister.
Yes.
Can you just provide some detail about Learning TV rolling out tomorrow? Why is it coming back? What can we expect?
So we will have young people at home in Auckland for the lockdown for the next week and a half at least. So we've envisaged that we may need to liven up Learning TV and the hard packs of materials when we ended the last lockdown. So we were in the process of continuing to produce hard packs of materials when the last lockdown ended. So we've warehoused those, we've got them ready to go, and we're ready to distribute them from Monday onwards. Similarly with digital devices, we've been working to secure supply of digital devices so that we can continue that, and obviously our focus is going to be on making sure that those in Auckland get them, with a particular focus on those who are working towards NCEA, because obviously they can't really afford to be losing any time at all at the moment, so they're right at the top of the priority list. The Learning TV will be a mix of old and new, so we have obviously got the content that was produced last time. We've got a whole store of content that we drew on last time, but it will be more focused at that younger age bracket. What we found with the ratings from last time around was that the uptake amongst older young people was not particularly high, and so therefore there is a real demand in that early childhood and primary schooling space for this content, and that's where the focus will be. So that's why it's now 9 a.m. to 1 p.m. and it will replace TVNZ Duke during that time.
Minister, I just have a couple of questions. We must be around 100,000 tests now since 12th of August. How are our stocks of the swabs? How many more days will we have ready for?
So we had, I don't think we're quite at the 100,000 mark, but certainly we're moving up exponentially at that kind of testing rate. When we began this, we had 280,000 test kits on hand, ready to go, and of course we are moving them around if we need to make sure that they're in the right place, and new suppliers are added all of the time. So the Director General may have the latest update on supplies coming in, but we certainly don't stop adding to the supply. We continue to add to the supply as we use it.
The only other comment I will make is, as we found earlier in this outbreak, often the supply chains are, because the makers, particularly of the reagent, are balancing it right across the globe. So we're not sort of allowed to carry hundreds of thousands of test supplies, but we had a very good stock and very good supply chains for all the different lab platforms and also the swabs.
Just quickly, in terms of police, what action will be taken around rule breakers during level 3? I know you're not police or anything like that, but what action can expect to be taken of people that are, going out, using their boats, using park equipment? Will police be monitoring and enforcing that?
Look, I think you can expect the same kind of enforcement that we had the last time around, and I'd encourage you to raise that directly with the police. Obviously, they are the enforcement agency with regard to the travel restrictions. If you do like, I've got some stats for you, though. I'm sure that everyone's interested in statistics. So as at 4 o'clock yesterday, the total number of vehicles stopped at the Auckland checkpoints was 50,468. The number of vehicles turned back was 676, so that's actually a relatively low number relative to the number of vehicles stopped. And of that, 428 of those were seeking to leave Auckland, and 248 of them were trying to get into Auckland.
Some people we've spoken to in Auckland today say their rules haven't been communicated clearly enough around what they can and can't do. What is your response to that?
Is that in terms of travel outside, in and out of Auckland?
Mucking around in Auckland like normal.
Oh, look, I think New Zealanders are now reasonably familiar with the level 3 lockdown rules. We've been through it before, but of course everybody needs a reminder from time to time. The Covid-19 app and the Covid-19 website are the places to go. So there is a, not app, the website page, which has got all the stuff that's accessible on your phone. That is the place to go for the most up-to-date information. It tells you what you should and shouldn't be doing with the level 3 restrictions.
I'll
let you finish that line of questioning.
Yeah, just in layman's terms, I mean, that means don't, go and socialise and, adhere to social distancing. In layman's terms, what does that mean? What does that picture look like?
Yeah, so look, the general picture should be, minimise the amount of movement that you have, minimise the number of people that you're coming into contact with, and keep that to essential only. So if you don't need to come into contact with someone, just stay home. If you're going to work, then obviously adhere all of the rules in your workplace to keep everybody safe. Make sure that you're maintaining social distancing when you're out in public, so that you're not, increasing the risk of spreading the virus. I don't know whether the Director General wants to add to that, but I think New Zealanders are reasonably familiar now with what the restrictions are at the different levels.
Is the advice to then sort of act as if you have COVID as like it was last time?
Absolutely. It should always be. And again, even at level 2 for the rest of the country, again, just think about minimising risk. Just thinking about everybody, including us. We should all be thinking about, is this necessary? Could this just wait a couple of weeks? Let's just all do what we can to stop any risk of spreading of the virus.
The family of former Cook Islands Prime Minister Dr. Joe Williams is unhappy about his name and his positive result being publicised, and it had a knock-on effect for the Cooks. Do you have any thoughts about publicising positive cases for people with such profile when it can actually have implications for borders and communities?
So we're very careful with the information that we release, to try and protect people's identities. In this particular case, obviously, once all of that information is out in the public domain and we get asked specific questions about that, we will endeavour to answer them. But generally speaking, yes, I think it would be much more preferable if people's identities were not released. Now, in this case, given the profile and so on, it was bound to be that local community would figure out sooner rather than later who the person was. That doesn't mean we need to amplify that, though. Like I said, there's no shame in COVID-19. Our contact tracing system is designed to ensure that those who need to know do know, and know as quickly as possible.
So, Dr. the testing timeframes, you mentioned that sometimes up to as much as 48 hours currently. We're hearing that some people are actually waiting for 4 days for a COVID test to come back. One, is that acceptable? Two, what's the sort of, the tail of testing? How long are these tests taking to come back in the worst case scenario?
Well, just to emphasise what the Minister said earlier on, sometimes it's taking up to 48 hours to process the volume of tests. There is a backlog, and not surprising given we have hit 100,000 since the 1st of August, so that's a large volume of testing. There's then also the checking of the results, the processing and the reporting back. The key point here is, as happened earlier in the outbreak, any positive test is notified immediately by the lab to the public health unit, and then contact made with the person. So I'm not worried about the delay in testing. The really key things we're wanting is for a rapid time from symptom onset to testing of people, and we're seeing that happening, and a rapid time of identifying and contacting people who may need to go into isolation. And anyone who's in a close contact in self-isolation has to remain in self-isolation until the test result comes back. All right, so
we'll do about 5 more minutes, so last round of questioning, and we'll move from the left to the right. So starting over here.
Okay, I'll start with Dr. Bloomfield and come to you, Chris. Of the 1,322 close contacts, Dr. Bloomfield, how many of those close contacts you've contacted have been tested?
Well, if they're close contacts, they'll almost all be tested. I can check that, but if they're close contacts, routinely now we are testing.
And whether the Prime Minister will have tomorrow's numbers that get announced at 1 p.m. before she makes that decision at 10 p.m. about the election? Will she have all that information?
Well, yes, our cut-off for new cases each day is 9 o'clock, and so we will. The Prime Minister and the Minister, of course, will have an update on any new cases that have arisen since 9 o'clock this morning.
You can have one more.
On indulgence, thank you, Minister. Given at your outset, you gave this plea to avoid misinformation on social media, does it give you pause for thought the way the government uses social media? You've made announcements yourself bypassing traditional media directly on Facebook. Does it give you pause for thought at all how you engage with the social networks?
Look, I think the government works very hard to ensure that we are providing trusted information out there, and like I said, the most authoritative sources are what we say here, what we're putting on the website, the Ministry of Health and the COVID-19 website. Social media is a good way for the government to get messages out. We're, of course, pushing messages out with paid advertising on social media because it is an effective way of reaching people. But really the message to everybody is verify your source. Yeah.
Really quick questions, directed to either of you. This first one, an iwi in Oakuni is calling for an immediate regional lockdown after a positive case visited Mount Ruapehu. What's your response to this?
I'll come back to the Director General.
So two comments there. First of all, I've heard from the DHB Chief Executive at Whanganui, Russell Simpson. He's working with the local government and the iwi to, I guess, address the concerns that they have. And that person that visited Tokoroa ski field was not symptomatic at the time, and it's only a short period of that time that they were on the ski field that is in that 48-hour pre-symptom onset. So the risk is very low. The right steps have been taken there, and I think a number of the ski field staff have been tested. Of course, we will report the results of that testing as soon as it's available. So
right,
the risk is very low.
No, that's right. Just Minister, really quickly, what is your preference for the election? Should we still go ahead in September?
I'll leave that one to the Prime Minister tomorrow. We'll continue working our way across.
Well, is it at all possible that the virus has been reintroduced here by travelling via frozen food, frozen packaging? Is that theoretically a possibility?
Look, it is a possibility, and we've talked about that. I could say it's a low possibility, but it's not impossible. And so we are, especially because we have this sort of centre of the outbreak, and the earliest symptom onset of one of the cases is someone who worked in the Americold workplace. So that's one to be ruled out.
Also, there was a pretty big lotto jackpot last night. If you won lotto, Dr. Bloomfield, what would you do?
Well, unfortunately, I won't be in that position because I haven't bought a ticket. But well, I think that's a bigger question. And maybe the rest of New Zealand would have exactly the same ideas about what they might do with it.
All right. Any further questions over here? Last one, Sam.
Just one around the, you talk about the supply of swabs, testing agents coming in. This may be an obvious question, but what are the public health measures, testing measures of those workers who are handling that coming in? I mean, I imagine the potential for environmental transfer from a person onto that medical equipment would be quite low, but also it would have a high risk of proliferating were that possible. So are they being tested regularly, those workers who are handling that sort of equipment?
I'll let the Director General comment on that. I know that there is incredibly stringent what's it called? Infection prevention and control measures when it comes to all medical supplies, but I'll let the Director General comment.
Yeah, I think there's nothing special that needs to be done. The particular interest in the Americold situation is because of the refrigeration here, and we know that the virus does survive. It can survive quite a long time in cold temperatures.
All right, thanks very much, everybody. We might call it a day there. Thank you.
And now featuring Petal Search, your gateway to a million apps.